Good morning, everybody. Today, I'm here to discuss a very basic thing in life, in medicine, and health benefits. Okay, now, first, let me start with a story of my own self, followed by little medical advice. Now, some of you may have gone through my surgical slides in YouTube. Most of you probably haven't, but that's why I probably thought of getting it onto Facebook also, so that it reaches more number of audiences, whoever watches it. It's just an advice and take home message. If you can do it, probably your life can make a little bit of difference, and you probably have an improved life in the future if you follow. Not really follow, I mean if you just do something about what I'm going to tell you today. Now, just cutting down everything, I was a person, as some of you may know, I'm an orthopedic surgeon. I was into exercises once upon a time. I used to do bodybuilding. I used to go to the gym, lift weights, try to build up muscles, and a lot of things I did. Used to take whey protein and all those things to build up muscles, and many years I've spent in the gym. That was almost many years back. Then exercises stopped for various reasons. And what happened gradually, obviously I'm a semi-old man. If you consider me an old man, fine. I'm a semi-old man right now. But gradually things in my body started going wrong. I developed blood pressure. Initially it was less. Gradually the blood pressure started going up. The medicine started going up. It was one medicine, then multiple medicine for blood pressure, which I never had. I got blood sugar. I became diabetic. Diabetic medicine started, and they also started adding up. I started having dyslipidemia. That means my cholesterol level went up, my triglyceride level went up. I have had a problem of anxiety, which also went up. So I started having all these problems, and they were all inside a vicious cycle. Anxiety, diabetes, hypertension, lipid profile, lack of energy, not feeling like giving. I have to work hard to earn some money for my animals, I know, but it was becoming difficult for me. Like I used to feel sleepy, tired at the end of the day, could not work much, and the number of medicines started going up and up. So I tried various measures. I thought I'll do a little bit of running. I thought I'll do a little bit of yoga, but I couldn't hold on to any of these things. So I thought one day that I used to do bodybuilding and weight training. So why don't I try giving it a try, giving it an effort. My main problem was I worked till very late night, so none of the gyms will be open till that late for me to go and work out in the gym. So I have a very small flat, so I thought of giving it a try in the house. So I bought myself a small bench, exercise bench. I bought a kettlebell. I bought a few. I bought a barbell with weights. I bought a few dumbbells. I bought a few resistance bands, and I started exercises at home. This has been almost going on for 6 to 7 months. Now, I'm not trying to boast. I'm saying that I'm exercising. It's nothing of that sort. This video is nothing about why. I mean, I'm an exercise-loving person. It's nothing about that sort. It's for you people to understand a certain facts. After a few days of exercises, I started noticing a little bit of dizziness, and then I told my assistant to check my blood pressure, and I saw strangely my blood pressure had fallen down. After couple of months of exercise, I got my blood sugar, I got my glycolic hemoglobin HbA1c done, and I found it has come down extremely low. My blood pressure medicine went down to 1/4 of what it was, only one medicine. My blood sugar medicine just went down to 1. My depression medicine went down to 1. I started doing all kinds of, not all kinds, I started doing something what you people who are into exercise call high intensity training. I don't call it very high intensity training. I do a little bit of kettlebell training, a little weight training, not very heavy weights. I'm not here to build muscles. I'm here to fight my sugar, my blood pressure, my cholesterol. So I do a little bit of weight training, repeated weights, not very, very heavy weights, followed by cardiac exercises like planks, little bit of spot jogging, jumping, etc., etc., etc. So all I'm trying to tell you is, once upon a time, and even now, I keep on telling my patients, especially patients who come to us, us orthopedic surgeons, they come with knee pain, back pain, post-operative complications, and exercise is kind of must for them. And even they come with metabolic disorders, I tell them to exercise. A lot of people come with obesity, tell them to exercise. A lot of people come with comorbidities like diabetes, hypertension, thyroid, lipid dystrophy. I tell them to exercise. I used to tell them to exercise, myself not doing exercises that time. But now that I have started exercise, believe me, I have lost 4 kilos in the last 3 to 4 months. So it has been a good thing from my side, but I'm trying to tell you that exercise does make an important change in life. Now, why do you think it brings some changes? So basically, when you are doing exercise, you are doing two type of exercise. You are doing aerobic and you are doing anaerobic. Aerobic means your cardio exercises, and anaerobic means your weightlifting or resistance training. So basically, I should tell you that you should combine both these things. Your resistance training followed by your cardio. What happens is, if you combine your resistance training with cardio, your mitochondrial activities inside the cells improve, your insulin sensitivity improves, the blood sugar is directly pushed into the muscles, your oxidative enzymes get elevated. As a result, your blood vessels become more pliable, your blood pressure comes down, your cardiorespiratory status improves, you have more amount of oxygen in the body, you feel energetic, you get a good night's sleep. And another thing, for people like us who sometimes go through depression, it really increases the endorphins in the body and gives you peace of mind. It has happened so many times. Some of the days when I'm feeling very down, even at 2 o'clock at night, at 3 o'clock at night, I'm not able to sleep, feeling down, I go, push a little weight, do a little cardiac exercises, and I feel better. It's just my endorphins go up and I feel better. Now, people come and tell me, I don't have time for exercises. I don't have the time for it. I said, if you have the time to eat, if you have the time to have a party, if you have the time to visit somewhere, if you have the time for something which is absolutely a daily affair, you have time for exercises. It's just that what you need to see is, once you start your exercises, once you feel and stand in front of the mirror and look at yourself, and you feel that your body is changing and your blood pressure is coming down, your blood sugar is coming down, your lipid profile is coming down, you're feeling you are a more healthy person, you will automatically continue your exercises. So please take home the message that along with your medications for whatever comorbidities you're suffering from, especially people with metabolic disorders like what I suffer from, exercise is a very, very important part of life. Take it very seriously. It's a very simple message I'm trying to send out to all of you. It's nothing about complicated operative videos which are presented before in my YouTube channels, nothing of that sort. It's a simple request, simple call to all of you. Please do little bit of exercises. You cannot do weight training, fine, you do aerobics. You can do stand somewhere and do a little bit of jogging. You can jump. You can do a little bit of push-ups. You can do planks. You don't need to buy weights like me, what I've done. You can do exercises without any kind of device. It's easily possible. Look up in Google. There are hundreds of exercises that can be done, and believe me, there will be channels which will be telling you these are the best exercise, that is the best exercise, those are the best exercises, 10 best exercises, 5 best exercises. Nothing of that sort. You exercise, you feel you're panting inside, you are
like breathing fast, your heart rate is going up. That is what is required. And spend at least half an hour every day on exercise. Walking is not the only exercise. Please, everybody tells I'm not able to walk, not able to walk, not able to. I just bring home the fact. Yes, walking is a wonderful exercise. I'm not taking out walking from your life, but walking is not the only exercise. There are hundreds of other exercises by which you can maintain a proper, healthy life. And please keep on doing it. Be happy, be healthy, be peaceful. Thank you.